PCOS, as you know, can be really challenging to work with sometimes, but it is completely possible to overcome a lot of the challenges associated with PCOS and have regular cycles and not really have any observable problems from it and put out all those fires and inflammation as a result of the PCOS. Hi, I'm Dr. Angela McKaye, chiropractor and naturopathic physician, and we're talking about PCOS or polycystic ovarian syndrome this week. And I want to share with you a case study for a patient that I had who has PCOS, who's had an amazing success story. So I have a patient who is 29. She'd had problems with her periods her whole life, at least since 15 when she was put on oral contraceptive pill for dysmenorrhea. She'd go 3 months without a period and then be really sick, throwing up, cramping, nausea, vomiting, heavy cycle, and miss 2 weeks of school and not be able to function during that time. So at the time, they did a workup for endometriosis. They didn't consider PCOS because this patient had sort of normal teenage acne, not a lot of hair growth, and not all the signs and symptoms of PCOS, had a normal body weight. Put her on oral contraceptive pill and she stayed on that until her 20s when she really wanted to have a child. Once she got married at the age of 25 or 26, and then at 27 got pregnant and gained probably 150 or so pounds during that pregnancy, which was disproportionate to what she had been eating. So the weight gain came on suddenly. She didn't have any problems achieving pregnancy or maintaining the pregnancy, but she had preeclampsia, which is high blood pressure during pregnancy, and she didn't have gestational diabetes, but they told her she was right on the edge. So following delivery, she lost a little bit of weight, but not all of it. She was working hard, doing a 1,200 calorie a day diet, working out with a trainer multiple times per week, going to the gym every single day, watching what she ate, and actually was gaining weight during that time. And she did that for about 3 months and then finally said, to heck with this, and stopped doing it. She had an infant that she was caring for at the time, was a stay-at-home mom, and wasn't seeing any benefit of it, so just decided to stop. She went to her regular primary care doctor, who said, well, I think you've got PCOS. They didn't do any further workup or tell her anything else about that condition, just said, I think you've got PCOS. Here, take the pill, eat less, exercise more. And she's like, I already did that. So I saw her several years down the road. Her child was about 8. So, 8 years after the onset of all of this. And we worked together, and it took a little bit of time, but we found several different ways to help, including pharmaceutical medications, dietary changes, sleep changes, and nutritional changes along with the diet. So some supplements and herbs and other things to really regulate her cycle. She wanted to come off the pill, and she wanted to have another child. And so we worked with those things. She's lost 80 pounds and has regular cycles every month. And we're waiting to see about baby number 2, but everything there looks promising, so we'll have to keep you updated on that. And a lot of her problems with, she didn't have hair loss until after the baby was born, which initially that was diagnosed as just like, well, you get a lot of hair when you're pregnant and then you shed it after you have the baby. But it was continuing on further than that. So that is stopped. And so we've been addressing all of those issues with both conventional medicine and naturopathic care, and she's remarkably better and really happy with her progress. We'll go into detail later on what dietary changes and what other treatments that we did for her. So if you're curious about that, you want to know what kind of treatments we use, stay tuned, because we'll be talking about that in just a little bit.